This is
Make it plain.
Make it plain.
MIP
With Masamela Matfumo.
Mark Thompson.
Make it plain.
Get woke.
God bless you. Get woke. Folks, MIP is now COVID-free, meaning free to all subscribers as we navigate this pandemic. We're thinking about everyone, and we've got to get through this together. So for a limited time, no fee to subscribe to Make It Plain on your favorite podcast app. God bless you, folks, and get woke again as we count down to the Poor People's Campaign Mass Moral Assembly on June 20th. Don't forget to go to june2020.org, Mass Poor People's Assembly and Moral March on Washington. It'll be digital and virtual. But as a build up to that, we still want to share with you some of the personal stories of people who are impoverished here in America and who have been dealing with poverty. Reverend Barber and I thought it would be important to hear from some of these voices. You know, we always hear from celebrity leaders, but sometimes it's important to hear from some of the people and hear their real stories. So we're going to hear from Hope, who is in Johnson, Pennsylvania, as we get ready for the Mass Poor People's Assembly.
My name is Hope Koss, and I am a coordinator with Put People First PA from Johnstown, Pennsylvania. Johnstown is one of the poorest towns in the state. I was born into poverty, and I grew up poor. I knew I couldn't afford to go to college, so I joined the military to get access to things like healthcare, education, and housing. The poverty draft is very real. I was then faced with discrimination as a woman in the military and got sent home. I experienced homelessness, having to have different family members and friends take me in when I returned home. My plan was to enlist for at least 6 years, so I had no home to return to when plans fell through. But I knew I had to continue to fight, so after some time, I joined Put People First PA, and there I was introduced to the Poor People's Campaign, a national call for moral revival. I joined Put People First and the Poor People's Campaign because I could not stand silently by and watch others be hurt by the same poverty draft that so deeply affected me. Currently, in Put People First PA, we are fighting for healthcare as a human right in a state where UPMC, the University of Pittsburgh Medical Center, is the largest employer. This $20 billion nonprofit, let me repeat that, $20 billion nonprofit controls many of the hospitals across the state, a bevy of specialists, and even an insurance company bearing its name. They buy failing rural hospitals under the pretense of reviving them, and they let them fail, so they can rezone the property and resell it, making millions, while the residents in the area who relied on those hospitals die because they cannot afford to travel to the next town to gain access to the healthcare that they need. In less than a year, they did this to the residents of Lancaster and more recently, Sunbury, Pennsylvania. This trend cannot continue because folks are paying with their lives. So on June 20th, 2020, Pennsylvania will join the Moral March on Washington, D.C. to fight for all of those who have been harmed by this so we can save our lives. Somebody's hurting our people, and it's gone on far too long.
Poor People's Campaign, the Mass Poor People's Assembly, and the Moral March on Washington, june2020.org. Ladies and gentlemen, my guest today, no stranger to the show, but for the record, let's let you know a little bit about what she's done At one time, she was a press secretary for the late Brooklyn District Attorney Ken Thompson, and played a very pivotal role at that. She also has served as the legal editor for the Brooklyn Daily Eagle newspaper. She's a New York native, raised in Georgia, attended New York Law School, Vassar. She currently is responsible for creating and executing Democracy Forward's media and communications strategy. She is the communications director at Democracy Forward. We welcome back to Make It Plain, Charisma Troiano. Hello, sister. How are you?
I'm good. Thank you so much for having me back on. I love chatting with you guys.
Well, always a pleasure to have you. And whenever you're with us, we always hear about great and important work that is going on. The work never stops on so many fronts in the midst of this pandemic, but obviously, too, we are having in the middle of a police-demic, too, so to speak. Let's start there if we could. Democracy Forward did make a statement about the injustices that are going on. And if you don't mind, share with the audience, where you all stand on that, what you all are thinking, and maybe some of the ideas you all have.
Yeah. So, us at Democracy Forward, just like everyone else around the country, have been witnessing and paying very close attention to what's been going on as it relates to police brutality in this country, and even more pulled back, just overall systemic racism in this country and the consequences of that. And so while our focus is primarily on looking at the executive branch and unlawful actions that the executive branch takes, we are also aware that the actions that this administration has taken really does exacerbate those underlying systematic, oppression, systematic racism, and all the consequences that come along with that level of oppression. The actions that this administration has done doubles down on that. We see that, for example, in instances in which the administration misled Congress on whether or not DACA recipients, for example, are eligible for federal home loans. They initially told Congress that, of course, we haven't changed any policy, but yet they were secretly and behind the scenes quietly calling lenders saying, hey, DACA recipients, you're not going to give them federal home loans. We've also seen instances in which this administration has pulled back data collection when it comes to racial pay disparities, when it comes to the ways in which small businesses, particularly minority-owned businesses, are being lent to. And so those are some real concerns and real actions that this administration has taken, illegal actions that this administration has taken, that really does just add more to the issues that we see with regard to repression and oppression because of systemic racism. And what we at Democracy Forward are doing are really taking actions to put a halt to those unlawful actions that this administration has undertaken. And even more so, we are calling out, we are asking for those who work with racial justice organizations to let us know. We have as many eyes open as we can, but we can't see everything that the administration is doing. And if the administration is taking actions that's making your work as a racial justice organization harder, let us know. We will do our best to look and see if those actions are unlawful and what actions can be taken to redress that. So, we're trying to find out what we can do within our own wheelhouse to make sure that we're listening, that we're being aware, but that we're also putting our minds and our efforts to work.
Yeah. It seems like everything is happening at one time. It's a little bit overwhelming.
You can feel that. You can definitely feel that.
Yeah. But I'm also seeing a lot of people that I've never seen before trying to learn, showing more concern. A lot of folk have still been in denial about some of the things that have been happening to us as African Americans forever. And I think it started with Ahmaud Arbery. I mean, I had white friends of mine who had just never seen anything like that. And then obviously George Floyd, and it just seems like, one thing after the other. But even in the midst of this, we got to fight a pandemic.
Right.
And that's not going that well. You all have filed suit, correct? Because when it comes to the Affordable Care Act and COVID-19, is that what we call an exceptional circumstance?
I would think so. I
Yeah.
think that most people would call a once in a generation, deadly and highly contagious pandemic an exceptional circumstance. But this administration, President Trump, says no. And that's right. We filed suit on behalf of the city of Chicago just yesterday because this administration has refused to follow the law, and in particular the Affordable Care Act, which, as you know, is a law that the administration does not like. But that law requires a new special enrollment period be opened anytime that there's an exceptional circumstance that's outside of customers' control. And typically an exceptional circumstance is something that's an unanticipated event, a natural disaster. For example, we've seen the special enrollment periods open up in instances where we've had hurricanes and floods, but we have not had this administration take that step to say, I know that there are over 200 we're nearing 200,000 deaths of COVID related deaths in this country. We know that there are over 2 million cases in this country. And yet this administration refuses to allow Americans who really do need access to quality and affordable healthcare to be able to access that, to be able to get back on the federal exchanges and enroll in healthcare in order to be able to deal with the health consequences that come with a very contagious, highly deadly virus. And that, plain and simple, is just unlawful. And this action is harming not only Americans who aren't able to access the healthcare exchanges, but this is more particularly harming Chicago and other cities like it who have federal exchanges, who are now going to have to not only deal with the economic fallout that results from having to care for an entire city as they weather this storm, but also to now have to take on the additional burden of the uninsured and the underinsured, which are normally things that you would be able to assuage because of access to federal healthcare. But this administration has removed that safety net from individuals.
And so again, this, you filed on behalf of Chicago, but this affects everyone, doesn't
That's
it?
right.
I mean, it's not going to extend the period. So you file a suit such as this one. What happens next in terms of the process? And are we up against any kind of clock when it comes to open enrollment expiring and the lawsuit actually being heard?
Yeah, so where we are now is that we have asked for the court to issue a preliminary injunction. So what we've essentially asked the court to do is to immediately order the reopening of the federal exchanges while the case proceeds. And so that was filed also yesterday. We'll have to wait and see where the court goes with that, but that would be the first item that would hopefully be ruled on, because we're asking and noting that this is an immediate need. And the ultimate impact of this case would be that you would have this short period of time where individuals would have that special enrollment period to be able to, for the reasons or for the circumstance of the coronavirus, be able to get on the federal healthcare exchanges. And what's really unnerving about this, aside from just the blatant, on its face illegal action this administration has taken, is that there is widespread support for reopening the special enrollment period. You have health insurers who have asked for this. You have bipartisan support across Republican as well as Democrat administrations statewide, who have asked and noted the benefits of being able to have their residents have access to affordable and quality health care through the exchanges. By doing so, you are able to not only test, more folks who are afraid of going to get a test out of fear that there may be a cost and they don't have insurance, for example, to cover that. You would have individuals who are feeling ill be more comfortable going to get well. And reduce the risk of transmitting that disease, the COVID-19 virus, to others. You would have, the ability to help contain the virus because people would be more comfortable and more able to go get medical assistance. And so this all goes hand in hand. You can't say you want to stem the curve or slow the curve and not actually take the steps to help make people better. And unfortunately, this administration is not only, have a abysmal record when it comes to the mismanagement of this crisis, but also taking illegal actions to make it worse for all of us.
And then, Charisma, when we look at cities like Chicago, there's disproportionality anyway when it comes to those infected. We know that this has disproportionately affected African Americans and other people of color and poor people and seniors. So in a city like Chicago, this makes this especially urgent because there have been some high numbers. And actually, I'm looking at some of the numbers that you shared with us. More than 49,000 Chicagoans have been infected with COVID-19, and 500,000 Chicagoans have lost their jobs because of the crisis.
That's right. That's right. And so for individuals who had healthcare through their employer, for example, another round of folks who were not previously, in the numbers of the uninsured now find themselves in that boat at no fault of their own. Again, an exceptional circumstance of a once in a generation pandemic. And so, the underlying disparities that we see in general across the healthcare field that we know is exacerbated that much more so because of the coronavirus pandemic is even then so exacerbated, like you just noted, because of this administration's refusal to allow for individuals to actually access the medical care that they need. And these disparities, we're seeing within also to the student loan realm. And I'm talking about another illegal action that this administration has taken within this coronavirus pandemic to make our lives that much worse off. And this is the administration illegally seizing tax refunds from individuals amid this pandemic, even though that is clearly against the law.
Yeah, and that's true. So if you lose your job, you have no health insurance, and you may not get COVID, but you still need health insurance for other things you might need, right? I mean, so that's a lot. I mean, that's no picnic situation to be in the middle of this. There are others who are joining the call, I see, for the extension or expansion of the enrollment period. Even other healthcare providers, Kaiser, Blue Cross, Blue Shield, and some others, aren't they?
That's right. That's right. There is widespread support for reopening these exchanges. I mean, it is a clear understanding of the need for Americans in this particular time to have access to healthcare, and the administration not being able to provide a reasoned or cogent rationale for not opening the exchanges flies in the face of the law. In fact, let me actually take that back, because President Trump did provide a reason why he refused to open up the ACA special enrollment, and that's because he doesn't want to prop up the ACA. It is his for Obamacare that is preventing him from actually providing help to Americans in need.
Yeah, yeah. So, folks, again, Democracy Forward has filed this suit. And just what you mentioned in and of itself, he doesn't like the ACA. He wants to undermine it. But this is literally playing politics with people's lives, isn't it? To try to, once again, undermine anything the ACA has to offer in the middle of a pandemic.
That's right. In the most immediate and literal sense, President Trump is playing politics with people's lives.
Yeah, yeah. So, folks, we want to watch this carefully. And so, again, for the moment, anyone who wanted to enroll and needed the extended time, at this moment, unless we get a preliminary injunction, is in trouble. They're at risk of not being able to enroll.
That's right. That is the unfortunate circumstance of the Trump administration's actions. And, in thinking about it too, for individuals who had the option to sign up for the ACA exchanges during open enrollment, for whatever reason, they probably didn't think that a pandemic was going to be coming along and like, I need healthcare in the long run. And so there are all these calculations that folks had in the before times, that do not apply here. And it's those unexpected, unintended, exceptional circumstances that the ACA built in its requirement that a new enrollment period be opened in the event that there's an unexpected, unintended circumstance outside of the consumer's control.
Right. And while they may not have expected it, I mean, we know the Trump administration had foreknowledge that this was coming. But it just speaks to the need overall for expanded access to health care, period. This was not a normal thing. And probably fewer people would have been affected and fewer people would have passed away if there had been more healthcare coverage, if there had been more preparation for this. And so now you put people in even greater danger by not extending the enrollment period. And you run the risk of more people getting sick, if not from COVID, from other things they can't get treated because they don't have any health care. That's more deaths.
That's right. And we know, that COVID is an upper respiratory virus. And so, you're at risk of getting so many other diseases and afflictions that could either make you more susceptible to COVID, or if you get it, make that worse for you. So absolutely.
Yeah. And I mean, frankly, we're already even hearing stories about people who are not, including people of color, especially African Americans, some of whom don't have access, aren't being treated. Then there are those who don't have COVID. They've got other emergencies, charisma, and then because of COVID, they're triaged, and so that's bad enough. And then on top of that, if you don't have insurance, what do you do? And that's the thing. We need expansion on healthcare more than anything. Democracy Forward, I mean, you all do this and you do it well. You always have the courage to step out there on stuff like this. So this is a good thing.
Thank you.
Yeah. And so, folks, we will keep you apprised of this. But again, the latest news is that Democracy Forward has filed suit. We'll see where this goes. But this needs to be done. 60-page lawsuit filed in court on June 15th, requesting even a preliminary injunction. Now, let's just elaborate on this, though. So an exceptional circumstance, there's actually a legal provision for that. I mean, that can happen. That's not.
Yeah,
right.
That is written in the ACA and its governing regulations, that a special enrollment period be open, or rather that HHS, the Department of Health and Human Services, open a special enrollment period in instances of an exceptional circumstance. And this isn't new. We've seen this before. We've seen a special enrollment period open before in instances of natural disasters, for hurricanes, for example. So it wouldn't be, the Trump administration taking this huge step in courage, here. It would just actually simply be the Trump administration doing right by the people that it governs.
Yeah.
And, it really does befuddle the mind here to try to sit back and figure out a rationale or a reason or an explanation, and there is none.
Yeah. No, there isn't. And if this is not an exceptional circumstance, I don't know what is. Yeah. I guess, I mean, this is the executive branch. If Congress wanted to do anything, can they do anything?
Yes, I believe that Congress would have the ability to make moves in this particular realm, but as we've seen right now, nothing concrete has happened. So at the moment, it is definitely incumbent on the Trump administration to do the right thing.
Yeah.
Or do the whole thing, rather.
And I mean, they could literally do it easily, like in 5 minutes with a stroke of a pen, couldn't they?
Yeah. So, Trump, if you want another, Rose Garden press conference, it is a really nice day and a really nice week planned ahead. By all means, go for it.
Well, I think, too, we also have to acknowledge, I mean, we're talking about Chicagoans, we're talking about disproportionality, but let's face it, there are folks in Trump's own constituency who have benefited from the ACA. We know that because that's why people in that constituency voted to give the House back to the Democrats in 2018. That was the issue. Do you want your health care taken away? Do you still want access to the Affordable Care Act? So, I mean, this is going to do harm not only to Chicagoans and people in the inner city and people of color, but anybody else who has to rely on that. And in his constituency, we're talking about a lot of seniors who themselves are at great risk to COVID. So this could help a whole lot of people.
It definitely can. I mean, and, you know, just looking at the numbers of how many are unemployed, we are now at 14% unemployment, you know, and not even breaking that down by demographics, looking at the number, I think there's like 36 million individuals who now don't have their jobs. And so yeah, this impacts and this affects, and this unlawful decision has an immediate and real life consequence to millions of Americans, regardless of your political affiliation, because as you just noted, the coronavirus doesn't care. You know, it doesn't care where you live, it doesn't care who you are, who you voted for. It will affect you, and it, you know, if we're not careful and if we don't have the access to the medical care that we need.
Yeah. Now there's another suit that you all had already filed on behalf of several cities and jurisdictions regarding the overall sabotage of the ACA. Where is that suit?
So in the moment, the suit is still proceeding. We are awaiting further movement by the court, but ultimately when the Trump administration tried to dismiss our case, they lost, and our case is still proceeding. And so we are really excited about that one. That one, we are also representing the city of Chicago, as well as Columbus, Cincinnati, Philadelphia, and two residents in Charlottesville, Virginia. So this is just another example. One can kind of look at it as a secondary, and it just happens to be because of the coronavirus pandemic that we're in now. But this goes hand in hand with the Trump administration's effort to sabotage the ACA from the inside out. Yeah.
So again, on extending the open enrollment period, Kaiser Family Foundation, Blue Cross Blue Shield, America's Health Insurance Plans, Democratic and Republican governors, including Arizona, Michigan, New Hampshire, New Jersey, and Oregon, all of them are singing in one voice that this should happen.
Yep.
Yeah. So, folks, we invite you to keep up with this at democracyforward.org. Is there anything that citizens or the public can do that you would suggest they do, Charisma, in terms of pressing for this, or should they contact elected representatives, or what do you think?
Yeah, I definitely and always suggest that individuals reach out to their representatives to express their concern. And, you know, we have a voice, whether it's in a newspaper letter to the editor, whether it's on Twitter, whether it's in a letter to the president or to other members of his cabinet. I really do think that it's essential and important for all of us in any way that we can to truly speak out and say what it is that we want. No one's going to act on our behalf unless we say what it is that we want and what it is that we need. And knowing that we need a special enrollment period to be open to allow for us, all of us, to be able to weather both the economic fallout as well as the health consequences of this pandemic, we need to speak up in any and every way that we can to let that be known and let that be heard.
Indeed. Folks, Charisma Troiano is the Communications Director at democracyforward.org. Stay up to date there. They're fighting for us, folks. They're fighting for all of us, and we appreciate that. Charisma, always good to see you.
Thank you so much. Always good to talk.
Thanks for checking in with us as always.
Absolutely.
All right. Bye-bye.
God, you are our refuge. Send our ancestors to guard our doors. Cast out this virus from our communities and our bodies. Heal, bless, and protect everyone listening and their loved ones. Thank you for listening to Make It Plain and Get Woke. Remember to listen, like, and subscribe on Apple Podcasts, Spotify, and wherever you get your podcasts. If all minds are clear, it has been made plain.
Everybody loves a sequel, especially when it comes to the world's most comfortable shoe. Introducing the Allbirds Wool Runner 2, a next-level revamp of the cult classic. 7 years in the making, it's been completely reimagined for a game-changing fit and feel. With enhanced cushioning and super soft materials, the Wool Runner 2 delivers comfy all-day wear built for bliss. Visit allbirds.com and use code FRESH24 to score a free pair of socks with purchase. That's ALLBIRDS.com, code FRESH24.
Celebrate the holidays at an Arizona state park. Whether it's a cool weather hike through the low desert, playing in the snow in the high country, or packing up the family in the RV and spending Christmas in the parks. Just don't forget the presents. Arizona state parks have something for everyone this holiday season. Find an Arizona state park near you by visiting azstateparks.com. And happy holidays from Arizona State Parks and Trails.